Hello, bonjour. My name is Maria Medved, and I am a professor of psychology at the American University of Paris. This is the first episode of 3 that explores the relationship between COVID-19 and gender. In this episode, we focus on the coronavirus in men. According to the most recent statistics, men are twice as likely to die of COVID-19 than women. That is, of people who have the virus, men have what's called a higher mortality rate. In this learning lab, we explore why this might be the case. Well, researchers don't know why exactly. They think about this difference in 2 main ways. One way is to consider biological differences. The other main way is to consider social differences. Researchers call their ideas about these gender differences hypotheses. Let's start with the biological hypotheses. The first has to do with our immune system. Our immune system is on the X chromosome, of which men have 1 and women have 2. Thus, the immune system is more active in women than men. As such, men might have a more difficult time fighting the virus. Another biological hypothesis has to do with hormones. Estrogen is a female sex hormone, and it is known to promote antiviral responses of the immune system. As men do not have this hormone, their response to the virus may be weaker. But there are also social differences. These are based on the idea that men and women act differently because they were raised differently. That is, boys and girls are taught how to behave like men and women. Let me mention a few ways men and women vary in terms of health behavior. Previous research has shown, for example, that men are less likely to wash their hands and are less likely to use soap after using the toilet. And yes, researchers follow people into washrooms, so beware. Globally, more men than women smoke, an activity that often involves shared cigarettes and lighters. And the likelihood of wearing a mask is lower in men than women. All of these behaviors could increase the amount of exposure to the virus. This is important because there is a suggestion that it is not only exposure to the virus that is key, but also the extent of exposure to the virus that is influential. A last hypothesis is related to the finding that men are more likely to delay seeking medical attention than women, even when they notice something suspicious or wrong. So that is another idea about the increased death rate of men with COVID-19, that they are sicker when they arrive at the hospital. So which hypothesis do you think explains the higher death rate in men? Well, as I mentioned, we don't know. It may be one of them, or it may be a combination of them. Many commentators argue that in times of crisis, gender is not a priority. Right now, we just don't have the time, we don't have the resources. In my learning lab, I've tried to show that, in fact, gender is a central issue. Gender matters. Please stay tuned for our upcoming episode where we will explore the relationship between COVID-19 and women.